welcome to week 3 of your Pharmacology 1 course. This week we're going to be looking at chapter 4, which is all about the routes of administration in the drug cycle. So when we're talking about route of administration, what we really want to know is how is the medicine getting into the body? Excuse me. And as last week we talked about how the FDA needed to know what drug form the medicine's going to be in. They also have to know what route is going to be safe and effective for that particular drug. So keep in mind that not all drugs can be used in all routes of administration. So that's really really important to keep in the back of your mind. Sometimes we have drugs that are approved for more than one route. And then, always there's disadvantages and advantages to everything. So these are some of the different routes of administration that we're going to be looking at. Topical, transdermal, oral, sublingual and buccal, nasal inhalation, nasogastric, gastrostomy, and I can never say that one, jejunostomy, vaginal, rectal, parenteral, intradermal, and then there's a few other miscellaneous routes. So we're just going to kind of briefly go through some of these. Again, the entire presentation is available to you so that you can read through it if you have any questions at all. The first route that is listed on here is topical. And topical, we typically think about being applied to the skin, but those also can be things applied to the eye. And here's an example of a ophthalmic ointment. And they're showing you the special way that you have to use ophthalmic ointments. One thing to keep in mind anytime we're using an ophthalmic is that it must be sterile. And the other thing is on our directions to the patient, we want to make sure that they know not to actually touch the tip of the applicator to the eye. Because that's really important. Some of the abbreviations that are associated with eyes and ears are also very important when we're talking about those routes of administration. And here you go, right here we've got left and right and both. And you can see that the D, the S, and the U are what determine which one it is, left, right, or both. So I actually came up, we had a little, and it's kind of a silly little I guess you'd call it a little jingle almost to keep track of which ones are which, and we kind of did it as a rap in one of the schools that I used to teach at, and it basically went A, ear, O, I, D, right, you both, D, right, you both. So it was A, ear, O, I, D, right, you both, D, right, you both. And D, right, D is for the right, U is for both. And then that meant that whatever's left over is your left. So, if you want to learn that little jingle or whatever you want to call it, that little rap, that might be something for you to use. But believe it or not, I actually had students who would kind of sing it to themselves when they were doing their exams and things like that. So whenever we think about administering a topical drug, we're always thinking of the patient's right and the patient's left, so keep that in mind as well. The next one is transdermal. Transdermal is different than topical. It's something that's applied to the skin, but it's more of a systemic effect. And we use a patch. So when we're talking about transdermal, that's kind of what makes the difference. Oral route is the route that's used a lot for pediatric patients. Oral could be anything that's delivered through the mouth. So it could be tablets, capsules, also liquids are all going to be through the mouth. Okay. Some of the disadvantages for orals are that, some patients have difficulty with them. You can't use them if you've got a patient who's unconscious. You can't use it in a patient who's vomiting. So there's just a lot of disadvantages, which kind of leads to some of these other routes of administration. Sublingual and buccal are also oral routes, but they're a little bit different. We're not actually swallowing something. A sublingual goes under the tongue, and the buccal is actually, if you think of somebody who might chew tobacco, that's what they're talking about. It's between the cheek and the lower jaw. So between the cheek and gum kind of area, that's what buccal is. Nasal is going to be in the nasal cavity. So it's spraying into the nasal cavity. Inhalation is going to be inhaled. So we're breathing it in. So the nasal can, nasal is specifically spraying something in the nose, whereas inhalation is breathing it through the lungs. So this is typically what we think of when we think of anesthesia. So there's an example of somebody who's getting an anesthetic gas. Let's see. We have the nasogastric, which is an NG tube. And so what happens is that NG tube goes through the nose and it goes down in through the esophagus and directly into the stomach. So anything that you can give orally, you can also give this way. And this would be, typically you'll see nasogastric used for patients who may be unconscious and things like that. Let's see. The next one is vaginal. And vaginal is obviously going to be inserted in the vagina. We're going to be using things like creams, ointments, and suppositories. We're also talking about contraceptive foams. Rectal is going to be used a lot of times when you're dealing with unconscious patients or patients who have extreme vomiting. That's when you're going to see rectal use. The parenteral use is what we think of when we think of anything that's IV is typically is called parenteral, and a lot of times that's what most people think. When they hear parenteral, they think IV, but really it can be anything intradermal, intramuscular, subcutaneous. So anything that we're going to inject into the skin. So anything really other than oral routes that would be considered parenteral. So any of those other routes, if we're not taking it orally, it's considered parenteral. Now, when you think of these four, intradermal, intramuscular, intravenous, and subcutaneous, basically what we're dealing with is an injection, and it's where is it going in those layers of skin. So here's an example of a layer of skin, and you can see the different layers of skin are going to determine where it's going to go. So this is a really good graphic for that. Here's a graphic of an actual syringe. So this is actually it's a BD syringe. So this is an insulin syringe. Excuse me. Actually it says it's a TB syringe, but the insulin syringes are going to look very similar, and they're just calibrated a little bit differently, and you can tell these little marks will tell you if it was turned sideways, you could see it a little bit better where they were labeled, and then you could tell what these marks indicated. Let's see. Couple other things I wanted to point out on this week. Here's a picture of a IV piggyback. So these antibiotics are going to usually come along with a regular IV line. So you've got a line going, you're already getting, dextrose, normal saline, whatever, and then this is going to be attached to that line. And this is just an example. This is actually Zosyn, which it's kind of interesting because this is actually in short supply right now. But Zosyn is an IV antibiotic, and it's like I said, it's actually in very short supply right now. So used for a lot of folks who are dealing with some serious infections, and a lot of hospitals are really struggling right now because they can't get this particular antibiotic. So there's a few other routes that you're going to read about in this particular chapter. You're also going to be looking at the drug cycle in this chapter. So once a drug is been administered, you're going to go through and you're going to look at ADME. So ADME is all about absorption, distribution, metabolism, and excretion. And depending on how we administer that drug is going to determine how this entire process happens. So how the drug goes through this cycle is going to be determined by how it's introduced into the body. So, that's going to be really important to kind of look through. So make sure you read through all about absorption, distribution, metabolism, and excretion. And as always, if you have any questions over the material from this week, please make sure you reach out to me, and I would be happy to help you with any questions. My number is 618-792-2293. Have a great week.